Hello everyone, I'm Sham from the marketing team and I will be giving you all a brief overview of our new antipsychotic drug, Garthperidone. Schizophrenia plagues 0.5 to 0.8 of the world's population. Although schizophrenia plagues people of all ages, symptoms begin to manifest in late adolescence and early adulthood, with most cases reported between the age range 16 to 30. Psychotic symptoms such as hallucinations, delusions, disorganized cognitive function may develop from the disease onset. Research has also shown that schizophrenia affects people from all walks of life, but has a higher prevalence amongst those of low socioeconomic status, including the homeless, unemployed, disabled, and substance abusers and users. Of these, over 30% are treatment-resistant cases. That is why there is a need for a drug, Garthperidone. Since 1952, just over 50 antipsychotic drugs have been introduced, but have not altered schizophrenia treatments immensely, as most of these drugs are similar in efficacy and focus primarily targeting psychotic symptoms such as delusions and hallucinations, with only clozapine being documented as fairly more effective in treatment-resistant cases. These drugs may also cause learning impairments, increase depressive symptoms, as well as aggression in patients. Our newly developed drug, Garthperidone, is effective in treatment-resistant cases while targeting hallucinations and delusions derived from psychosis. But also, our drug decreases depression, anxiety, and stress in schizophrenia patients. I'll now pass you on to my colleagues, Kenneth, our biologist, who will explain in more detail the current need for Garthperidone and other drugs available for the treatment of schizophrenia. Our pharmacologist, Peter, will then detail how Garthperidone works and the symptoms it combats, before Raid gives an overview of the clinical trials Garthperidone has undergone and will explain expenses related to the production and distribution of the drug. I will then end with a conclusion of the marketing consultant.
Thank you, Sham. Hi guys, I'm Sheng Yao. You can call me Kenneth. I'm the head of the biology department. There are many different factors that causes schizophrenia. It could be due to a genetic factor, biochemical factor, stressful environment, or misuse of drug and alcohol users. Antipsychotic drug controls symptoms by affecting the brain neurotransmitter dopamine. The drugs available today is like chlorpromazine, fluphenazine, haloperidol, and fluphenazine causes serious side effects such as muscle spasm and drowsiness. And most of the people are reluctant to take them. At the same time, people who take these antipsychotic drugs also consume anti-anxiety drugs because patients with schizophrenia often have anxiety. The drug that we are introducing today, Garthperidone, works like a normal antipsychotic drug, but has lesser side effects. It helps by controlling dopamine. Dopamine is a chemical released by neurons to send signals to other nerve cells. It helps to regulate movement, attention, and emotion responses. It also contributes to feelings of pleasures and satisfaction. When there's too much dopamine, the nerve cells will not get the right signals and causes muscle spasms, depression, and schizophrenia. Interestingly enough, having too little dopamine may lead to Parkinson's disease. Garthperidone controls the dopamine release and relieves muscle spasms and depressions, as the drug includes alprazolam, also known as Xanax. It is an anti-anxiety drug, and metoprolol, also known as Robaxin. It is a muscle relaxant drug. Peter from the pharmacy side will elaborate more on the drug used.
Garthperidone is an atypical antipsychotic polypill with a primary antipsychotic agent that works similarly to second-generation antipsychotics such as risperidone or ziprasidone, stimulating nerves to interfere with connections in the brain to block dopamine and serotonin. What makes it different is that it produces neuroleptic agents at a higher rate than competing drugs, making it so Garthperidone does not need to be taken as often, and it also contains compounds that can lessen the side effects atypical antipsychotics cause, such as headaches, anxiety, insomnia, and extrapyramidal effects. It can act as an antagonist to around 82% of D2 dopamine receptors, more than the 80% required for a drug to have an antipsychotic effect. The antipsychotic effects of Garthperidone last longer because it has a half-life of around 41 hours compared to risperidone's half-life of 20 hours or ziprasidone's half-life of around 8.5 hours when ingested orally, meaning it is able to keep up a steady state with only weekly doses. This also means that if for whatever reason the patient needs to stop taking the medicine, the withdrawal effects will be lessened, although it will take longer to wear off. Our drug can reduce side effects through the presence of compounds dedicated to counteracting the negative effects of the main antipsychotic compound, and through the workings of the main compound itself. Garthperidone contains compounds that can reduce the severity of headaches by controlling dopamine levels so that they are not below the threshold where they begin to cause severe migraines. There will still be some pain, but a typical painkiller can offset the effects. It reduces the effect of anxiety by acting as an antagonist to the serotonin receptor 5-HT1A, partially offsetting the side effect of reducing dopamine receptors. And finally, since our drug is only taken weekly, it also lessens the effects of insomnia and extrapyramidal effects, as the changes in brain chemistry happen over a long period of time.
Hi, my name is Raed Talbi, and in this part I will speak about developing team. In developing team, I will begin with evaluation. Evaluation since the new drugs is developed, since the new drugs is released, is need to be between 3 to 6 months. 3 to 6 months, and this period is the developing period as well. Okay, we have got a first step in this test, and I will speak about first one. First one is PICO. PICO is standing for patient characters, intervention, compare, and outcome. Review of all the assessment, cost and benefit, and also collect all the report. Let's go to the second part. Second part is clinical and bare clinical testing. In clinical and bare clinical testing, we will examining the drugs. We will examining the drugs in a mouse and see the reaction and make sure this drugs is not cause death. And then we will move to the next step. Next step is examining the drugs in 20 to 20 people. In 20 to 25 people, and see that in 20 and 25 people, and see the drugs, the negative side of the drugs. Then we will move to the next step, which is examining the drugs in 100 people and look of the benefit side of the drugs. Finally, we will examining the drugs in 1,000 people and comparing the two sides, the benefit side and the negative side as well. Okay, let's move to the last part, which is requirement for registration. Requirement for registration, I have got, according to my research, actually, I found two organizations. First one, FDA. FDA is Food and Drugs Administration, and the second organization, NDA. NDA is standing for New Drugs Application. Okay, FDA will look to the new drugs application, and they will take their decision whether is to allow the drugs be in the market or not. And for step, first one, effectiveness and safe. Second one, the benefit of using the drugs out of the risk. Third one, the purpose of rightness. And last one, manufacturing method. Thank you for listening.
Thank you, Raid. As I previously mentioned, schizophrenia affects an array of people of different ages and socioeconomic status. However, as more reported cases are dominant in those of a low socioeconomic background, a stigma is attached to schizophrenia. In marketing our drug, we hope to introduce informational seminars in schools, workplaces, and public venues such as libraries. These seminars will include a drug development team, as well as a psychiatrist to inform and educate listeners on schizophrenia and why garthperidone is the best form of treatment. Our marketing strategy will also be primarily geared towards adolescents and young adults, as research has shown they are mostly uninformed in totality with regards to schizophrenia. The aim will be to eliminate stereotypical views of schizophrenia and schizophrenia drug treatment, therefore increasing the number of patients using this form of treatment to combat their symptoms. Most schizophrenia patients take more than one drug to combat their psychosis, depression, anxiety, and muscle tremors. Garthperidone is an all-in-one drug that may initially be expensive to produce, but patients are more likely to spend a little more on one drug that targets all of their concerns rather than spending a smaller amount on a drug that may only combat one symptom, and therefore having to spend more money on more drugs. Our drug will in turn be the cheaper option for consumers, coupled with the improvement of less negative symptoms such as delusions, hallucinations, depression, and aggression, as well as bettered muscle movement. So, if you have schizophrenia, simply garth your way through. Thank you all for listening.